Good morning. Thank you. Thank you, everyone, for coming. Things are all things considered. When you look at other jurisdictions, things are going well here in Nova Scotia. We're doing well with COVID, but we need to hold the course. But before we talk about the overall COVID situation, I do want to start by recognizing continuing care assistants. Last week was Continuing Care Assistance Week, and I think we can all agree the people who do this work deserve our recognition and appreciation. They care for our loved ones during their most vulnerable years, and they're there for them when we can't be. So thank you to our continuing care assistants. There's never been it's never been a time when they've been more needed than over the last 20 months of the pandemic. So on behalf of Dr. Strang and the team at Public Health and all Nova Scotians, I thank you. I also want to welcome Alyson Lamb, Executive Director of Valley Regional Hospital, to today's briefing. She's going to provide an update on a small COVID outbreak at the Valley Regional Hospital and answer any questions on that. So I know we're all concerned when we hear about cases in our hospitals and our schools, and we're right to pay close attention to that. These are the places where we're supposed to feel the most safe. But if COVID is in our communities, it's going to find its way into these places as well. What's important is that we, as a province and as directed by Public Health, that we take quick action to prevent further spread. And we are. So far, Nova Scotians are doing a really good job fighting this fourth wave. The measures that Dr. Strang and his team have in place, they're working. And Nova Scotians are doing their part. The COVID activity in most parts of our province is very low. Nova Scotians are following public health restrictions and continuing to get vaccinated. Nova Scotia now has about 77% of our population fully vaccinated. That's really good. But we, of course, want to get it higher. The vaccines are safe and they're effective, and it's not too late to get that first dose. And I know some Nova Scotians are taking that step and getting that first dose, and I thank you. And to those of you that haven't yet, I urge you, book today. It's fast, it's easy, and we have appointments waiting for you right now. So take that first step. That's the good news part of things, I guess, but I do want to continue. I do personally continue to be concerned about a couple of things. Community spread continues in Halifax. It's mainly among those who are not vaccinated. There are clusters around the metro area. It's not widespread, but it exists. It's no surprise that we're seeing cases in our schools in communities where there is more COVID activity. As of today, we have 3 schools closed in the Halifax Regional Municipality, and we've taken those steps to avoid further spread. Because it's really simple. If COVID is in our communities, it's in our schools. And the best thing that every Nova Scotian can do to help is to get vaccinated. And while we're in this fourth wave, act like COVID is around you and continue to take the precautions that you've been asked to take by Public Health. We need to keep our friends, our family, our neighbors, and our communities safe from this virus, and we can do that by working together. So thank you, and I'll turn it over to Dr. Strang first, I think.
Thank you, Premier, and good morning, everybody. Before I start, I do want to thank Jan. She didn't want her last name used. She spent many hours. This is actually a hand-quilted tie that she made, and very generous of her to give that. So thank you, Jan. As of today, Nova Scotia has 187 active cases of COVID-19, so we continue to come down as people recover. And our case numbers and hospitalizations remain stable. Overall, Nova Scotia is doing very well at controlling the fourth wave. But it's far from over. But our vaccination efforts and the public health measures are working. As the Premier said, as expected, there are some pockets of COVID, but we are seeing moderate transmission that is not becoming widespread, and that is good news. As hard as it is, however, we do need to expect to see some cases in places like schools, hospitals, and other group settings. It's unavoidable. If COVID is in our communities, it is going to get into these settings. The outbreak at the Valley Regional Hospital started with some cases in that community, and I know Alyson will have more to say on this shortly. But for now, I'll say this: our good vaccination rates and the other layers of protection we have in place in our hospitals and schools are and will limit the spread even if COVID enters a facility. There is some community spread in the Halifax area related to families and close social groups. In many cases, these are little clusters of unvaccinated people, and there are some of the cases that link between the different groups. And not surprisingly, it's in these same pockets of community transmission where we're also seeing cases in schools, and in a few of those schools, we're seeing limited spread of the virus. And that's why there are currently 3 schools that we have had to close as a short-term measure to prevent further spread. And I'm happy to report that the children and staff of Duke Danville are back in school as of yesterday, and by all reports, things are going well. My medical officer of health team and the Department of Education and Early Childhood Development will assess when other students can safely come back to their classrooms. We want this to happen as soon as possible, not only to support children's learning, but also to provide social and developmental supports that these children need. And I know the situation around closed schools is concerning for families and school staff, and I don't want to downplay your concerns, but I do want to put that in a somewhat bigger context. Of the 370 public schools in Nova Scotia, about 44, or around 10%, have had at least one case. And of those 44 schools, only 11 have required increased public health measures, and only 4, which is 1% of our total number of schools in the province, have had to close to prevent further spread. So collectively, we are doing a good job of keeping COVID out of our schools, and as we've seen throughout the entire pandemic, there is limited spread within schools. In the school communities where there are concerns, we are targeting testing and vaccination supports for the schools, families, and the surrounding community. And with the exception of the 4 schools that we've talked about, the benefits of being in school continue to far outweigh the risks of disrupting school because of COVID-19. I want to provide an update to the expiry date for the take-home test kits that students under 12 began receiving last week and that we spoke about at the end of last week. We have now confirmed with Health Canada and the manufacturer that all of the tests are good for 10 months past the expiry date, which is on the package. And more details will be going out directly to the families who have received kits. In the meantime, if your child isn't feeling well, even if they have one mild symptom, follow the instructions in the kit and use the take-home rapid test. This is one way that we can all help keep COVID out of our schools. Since we last briefed you, we've continued to hear that the vast majority of people and businesses are being very cooperative and supportive of the proof of full vaccination requirement, and I thank everybody for their efforts. I want to remind Nova Scotians that any vaccine record is acceptable as long as it shows the required details. You do not need to have the new version with the QR code, and businesses should not be rejecting anyone who has a valid proof of vaccination, even if it doesn't have a QR code. And we have a reminder that identification needs to be shown along with a proof of vaccine, but if you don't have photo ID, a health card can also be used. Having said that, the new version with the QR code is preferable, and that's because starting this Friday, VaxCheck NS, the reader of the QR code, will start to become available. It's a special QR code app that businesses will be able to download onto a smartphone for free, and it will work with the Nova Scotia proof of vaccination to give a green confirmed response or a red sorry response. This will make it faster and easier for everyone to show their proof of vaccination at a restaurant, a recreational facility, or any other places where proof is required. And it also protects your personal health information. So we encourage people to start to download the QR code, but it's not essential that you have that. And if you have a paper copy, it's important not to shrink or fold the QR code because it won't be able to be scanned if you do that. And although even if you do, a business can still read the required details on the page to confirm your proof. You just won't be able to scan the QR code. So we're encouraging people to save it onto your phone or print it off and then carry it around with you. And we are working with the federal government on a wallet-sized version that will be able to be printed off and laminated, much easier to have around. People can get the new version of Nova Scotia's proof of vaccination on our website. All you need is your health card number and an email address or phone number which you gave when you booked your vaccine, and then you will be able to download that proof of vaccination with the QR code. And if for some reason you cannot get your record online, you can call the toll-free number. I know the line is experiencing higher than normal call volumes, and I'd ask for your patience. And when you do get through, you'll be able to get your record. It can be either emailed to you or through land mail to your home. Starting today, Nova Scotians who are moderately to severely immunocompromised or who are taking medications that substantively suppress their immune system are able to book a third dose of mRNA vaccine. Emerging research shows that these people may respond differently to vaccines, including lower antibody responses and lower vaccine effectiveness than the rest of us. And the National Advisory Committee on Immunization recommends a third dose for these people to increase their level of protection. Anyone who is eligible can schedule an appointment, either online or by phone. Details are on our website, 28 days after their second dose. And that's a minimum of 28 days. If it's longer than that, you'll just go ahead and make your appointment. However, before scheduling the appointment, please look at the detailed information on our coronavirus website to see if you actually are eligible and what information you need to bring to the vaccine appointment to confirm this. If you're not sure, you can speak with your healthcare provider. They have all been given detailed information on this requirement of a third dose for specific conditions. But you do not need to bring a letter from your doctor or nurse practitioner saying that you are eligible. So please, if all you're looking for is if you're thinking you need to go get the appointment with your doctor or nurse practitioner just to get a letter, you do not need to do that. Look on our website, and you need to bring specific information such as prescriptions as proof. If you are not eligible and you arrive for your appointment, you will be turned away. We have very specific criteria, and we have to make sure that the vaccine we have is offered for those who are truly eligible. Next week, we'll start rolling out booster doses of COVID vaccine for long-term care residents. We've been working with the long-term care facilities to prepare, and they will reach out to residents or their designated caregiver with more information. NACI recommends a booster dose at least 6 months after the primary vaccine series for long-term care residents. And they'll be also advised that they can get a COVID vaccine along with their influenza vaccine. So most residents in long-term care were among the first to get vaccinated in Nova Scotia, and that minimum 6-month time frame has passed, and they're able to now start receiving their booster doses. So in the days and the few weeks ahead, we have a great opportunity to give both the COVID booster dose and the annual flu vaccine to our long-term care residents. And so again, starting next week, it'll be a combination of COVID booster dose and the high-dose flu vaccine to help protect our most vulnerable seniors. Other Nova Scotians will be able to start getting their flu vaccine at a pharmacy or their doctor's office starting next Monday. And if you're booked for a COVID vaccine with your pharmacy, ask them if you can get your flu shot at the same time. We have to remember that these are different viruses, and the COVID vaccine will not prevent you from getting seasonal influenza. You still need your annual flu shot, especially if you work with or spend time with Nova Scotians who are more vulnerable and at risk for getting severely ill from influenza, and such as older Nova Scotians and those who are pregnant or immune compromised. We have to remember that the flu symptoms and COVID symptoms are very similar, and people who do start to have these symptoms should stay home, do their online COVID self-assessment. and then book a test if directed. Do not just assume this year. It's really important that if you have fever, cough, those type of symptoms, you can't just assume it's influenza. You need to get the test, do the screening, and get the test when appropriate. In the past, we've had deaths from influenza in Nova Scotia each year. Last year, we didn't have any confirmed cases, and that's likely because of the preventive measures we had in place to keep COVID controlled in our communities. So let's learn from the COVID experience and keep influenza to a minimum as well. And that includes vaccination for both viruses. And I want to provide a reminder to pregnant women, because I'm getting a number of questions about that from pregnant women, that influenza and COVID infections significantly increase the risk of severe illness and complications, including possible death to both you and your baby. Both vaccines are strongly recommended by NACI, so please, pregnant women, get both your COVID vaccine and your influenza vaccine. And as we navigate our way through this fourth wave, I want to thank Nova Scotians for sticking with us and continuing to follow our public health measures. It's been a long haul, and I know we are all tired. But the thing we can celebrate is that we are moving forward. We've been able to lift most of our restrictions. Our active case count is going down, and we haven't yet had to impose extra targeted restrictions in any specific area. Everything we're doing is working to keep people safe. So I'm asking you, all of us, to keep at it. Continue to get vaccinated. Stay home if you're sick. Keep up the daily health habits and spread caring and kindness. We're all in this together. And I have to end with this note. And for those who have been verbally abusive to staff at vaccine outreach clinics, because the proof of vaccine policy, this is unacceptable and needs to stop. Be thankful that you have an opportunity to protect yourself, your family, and your community, and be kind to those who are providing the vaccine for you. Alyson.
Thank you, Dr. Strang and Premier. So I'd like to provide an update from Nova Scotia Health. Nova Scotia Health has declared an outbreak at Valley Regional Hospital in Kentville. 3 patients in a non-COVID unit at Valley Regional Hospital have tested positive for COVID-19. One of those patients has been transferred to our intensive care unit. Affected patients have been isolated as per our infection control guidelines, and so far, more than 50 inpatient staff and physicians have been tested. An outbreak management team has been established to support the hospital's response. Additional measures like contact tracing and enhanced cleaning is underway. All other patients, staff, and visitors identified as close contacts will be tested. The outbreak at Valley Regional Hospital is limited as it stands. However, we wanted to share this information to be transparent about this evolving situation at our hospital. We are committed to keeping the public informed as more information becomes available. We know none of us want to hear about COVID in our hospitals or in our communities, but this is a reminder that COVID is still very real here in Nova Scotia. Thank you.
Thank you, Alyson. We'll now take questions from the room, and then we'll go to the phone lines. I'll open it up to the room. Go ahead, Mike.
Ms. Lamb, what do we know about how COVID got into Valley Regional, and when was it first detected?
So we do test every patient who is admitted. We identified a COVID positive patient on Friday and have started our investigation since then. 2 additional patients were identified yesterday, and hence why an outbreak has been declared at Valley Regional. So we're very early on in our investigations, but that is what we know to date.
And were patients 2 and 3 identified through close contact testing, or how did they come to be tested and then deemed positive?
With our initial investigation, when we identify a patient, we do start close contact tracing, and others were tested as related, and that's where those 2 were identified, yes.
Did you look at Dr. Davis's recommendations after the outbreak at the infirmary, and were those recommendations followed at Valley Regional?
Certainly, Dr. Davis has been engaged as part of our IPAC team, and those recommendations have been reviewed and implemented, and that is part of the reason we're here talking to you today, as well as the other containment measures from the lessons learned have been implemented.
Dr. Can you provide more detail on why the 3 schools were closed? Like, what prompted the closures? I know that there had been a number of exposures at each of them, but why did they close when they closed?
So in all the schools were similar. We'd had multiple introductions of the virus into the school, but we were seeing now transmission within the school, with each of those schools. So, the decision in all of them was essentially on that basis. We need to close them down for a short period of time, and then promote testing and vaccination over the week while the school is closed. And then we'll look to reopen that. Hopefully it'll be a week, but we'll have to monitor things and see what we're seeing in that community and what our testing of any more, of staff and students in that school shows.
So when was the transmission, I guess, discovered? For instance, I know École Marymount and Joseph Howe, like they were both open yesterday, and parents had been calling for the school to close since the week before. So was transmission only discovered yesterday?
No, it's a volume. If there's one case of if there's one case of a transmission within a school, we don't close it down. But it's an ongoing, almost daily assessment of what are we seeing, and we were seeing patterns of more cases where the likely explanation was exposure within the school. We were looking at these late last week, Thursday, Friday, and I had conversations with my medical officer of health team end of day Friday, and their recommendation was not yet. We need to continue to watch those schools carefully, and then on Sunday we had to make the decision that one of the schools, Dartmouth South, had to close right away. And then as they assessed things with the other two schools yesterday, we had reached the point with the new information coming forth on Monday that we needed to close those schools. So it's a daily assessment around what is the patterns of transmission and some of the other factors in the school.
I'm wondering why, given it's the fourth wave, why you wouldn't close a family of schools associated with a school where you found an outbreak as a precautionary measure.
If you look at the families of schools, we're not seeing any activity in those other families of schools. So our overall objective is to keep children and youth in school wherever possible. So and part of that is we have families of schools, you have elementary schools, junior high schools. Where most of the schools impacted are elementary schools, and because of vaccination, we don't have this same issue. There's much more protection in junior highs and high school. So right now we're comfortable taking a school-by-school approach to this.
What was uptake like on the vaccine clinic that you ran near Duke Danville?
I don't have those numbers. We did a number of over the weekend. We had a number of tests, and there was vaccine there. I don't have the direct numbers in front of me.
Can you tell us how many cases are linked to the Marymount school?
I don't have this. Well, I don't have those specific numbers. We're in double digits in that school. That's been going on for a couple of weeks, but it's just we reached a point where we're having to remember all of the schools start, and the majority of cases still in all the schools we've closed have been people from the community with bringing the virus into the school. What we look for is, are we seeing patterns of where there's been exposure within the school, and as long with, are we having multiple exposures? So rather than a classroom by classroom, we're starting to have multiple classrooms impacted.
Have any children been hospitalized?
No.
You know when businesses will be getting the readers for the QR codes?
As I said, that starting Friday, that app will become available. So it's not readers. I was incorrect when I said that a couple of weeks ago. They will start to have access to that where they can get online, no cost, the technology which will allow them to be able to then start scanning QR codes.
So will businesses be responsible for having that technology?
It can be done on a smartphone, and I'm sure I'd be very surprised if there's businesses who don't have at least one smartphone already in there as part of their business.
You're going to have to show ID if you come with the QR
Yes,
code?
it's that plus photo ID, because we have to confirm. But it's just the advantage is the QR code is very quick, the scanner. Plus, all that anybody is seeing is the red or green. It doesn't contain any personal health information, but people then still have to show whether it's a driver's license or people who don't have photo ID, your health card.
Dr. Strang, would the number of active cases at Joseph Howe and Dartmouth South also be in the double digits?
Yeah, they're in about, from 10 to I'm just going off the top of my head, between 10 and 15 that we've got, those schools that stand out. Whereas the vast majority of schools, even if they've had cases, have had, 2 or 3.
Why is there not more transparency for parents in terms of how many cases there are in a school and how it's being, if there's transmission? You mentioned that there was transmission early on at École Marymount, and it wasn't until, I guess, there was more transmission. Parents are asking for that information. They're not getting it. They can't make decisions about their kids, so why not?
So we continue to work. Public health continues to work with education. We did an additional communication to the parents at Marymount School late last week. It's always a balance between informing parents, but also making sure we're respecting privacy of individual cases and circumstances around transmission.
Dr. Strang, obviously people are very concerned about that young age group. We understand that Health Canada is in the process of approving, maybe for emergency use, the vaccine for children. Do you have a plan in place should that be approved to quickly get that out? Will there be vaccination clinics, or how will you deal with that?
Yeah, well, we're going to use our existing program, which is based mostly on pharmacy-delivered vaccination. So when we get the approval, and it's just we have to remember that we're still a ways from actually getting the vaccine. Health Canada now has to go through their regulatory process, reviewing thoroughly the information from Pfizer. Then their NACI has to review that same information. But once we get final through those two steps, the vaccine team is already working in detail planning that, and our approach is going to be with pharmacies. That's shown its success with our online booking tool and directing people to pharmacies and being able to tightly control how we distribute vaccine across the province to make sure that families and children will have good access on that. So I'm very comfortable that once we get the vaccine, we'll be able to start delivering that very quickly.
Ms. Lamb, at what stage is Valley Regional Hospital in terms of testing all patients and staff? I understand 50 have so far been tested. I'm wondering if more tests are to come or if you're anticipating any additional cases.
So when we identify an outbreak, there is a series of tests that do happen. So we've done our initial and we continue to develop. So based on the results of those tests, there will be further testing that happens over the next couple of weeks as the situation evolves.
Can you talk about how, or if there are any impacts at the hospital because of this, like on operations or anything?
As of right now, because it's so early on, there is no direct a reduction in service. Certainly we'll continue to assess and monitor, and we'll be notifying people if there is any.
Dr. Strang, I'm wondering if you can speak a little bit more about flu shots. I'm assuming they're coming out next week. Some professionals in other provinces are saying that it's more important, given the fourth wave, to get a flu shot. Why should Nova Scotians get 2 vaccines in a short period of time?
Essentially because we're quite likely to have 2 viruses circulating, and you need both. We don't know for sure what's going to happen, but we have to be prepared that we're going to get a resurgence of the flu virus, and there is the possibility, because it wasn't around, we had no flu activity in the country last year, and every year the flu activity helps boost people's immunity along with the vaccination. So there is the risk that we have less underlying immunity in our communities because we had no flu last year. So that's what our concern is, and it makes it even more important that people get their flu shot this year. They're 2 distinct viruses that they need their own individual vaccine to be protected against. So it's really important that people get both.
Are there any considerations for changes with respect to our approach with New Brunswick, given the activity that's going on in New Brunswick, or are we remaining status quo at the moment with them?
So I had a conversation with Atlantic Chief Medical Officers of Health. I do every Monday, and Dr. Russell. They're still having their the restrictions in place in the province, which is asking people to avoid non-essential travel in and out of various zones in New Brunswick. So we're asking Nova Scotians to continue to respect the public health recommendations from New Brunswick Public Health, and to pay attention, and in those zones to avoid non-essential travel to those parts of New Brunswick where New Brunswick Public Health themselves are still asking people to respect those restrictions.
Will negative COVID tests be required for the schools that closed? Will the students need them before going back?
we're not requiring them. We're strongly recommending people get a test in the we like our schools in the 2 to 3 days before people come back, and we're providing, like I'll use Duke Danville as an example. We had the last weekend we had the mobile units with both testing and vaccine right on site at the school, supporting the community with that.
Do you know how many students and staff were tested at Duke Danville before the school went back before classes went back?
I don't have the numbers in front of me in terms of that volume of what went on over the weekend. I've seen them, but I just don't have them with me.
So I believe originally the release did say that you were requiring a negative test. What changed there?
No, that was actually my mistake. And then I in a discussion, the letter that went out to students said all along that it's a strongly recommended. That was my error in my language.
Why not require it?
So that then you're on. How do you monitor that? How do you get where is the proof of test coming from, and who is actually then going to stand there at the door and check that record? There's a lot of logistical issues. We've had good uptake in our testing in that area, and we had lots of discussion with education about this, and we're both comfortable with a strong recommendation. And the other thing is that if you required it, that's only effective for that first day. What about Tuesday? Why do we not require it then every day when we go into school? So I think we need to be realistic at what's necessary and feasible, and continuing to support those communities and encourage people for testing and vaccination, and make sure it's very easy for them to access it and that they have the right information as well.
I'll take some questions from the phone now. We'll start with Ian Fairclough from the Chronicle Herald. Go ahead, Ian.
Thanks. Questions for Alyson Lamb. Just wondering, you said that the patient was identified as COVID positive on Friday. Just wondering when they were admitted and whether that admission was an emergency admission or if they came in for a scheduled surgery or scheduled treatment.
So we do have certainly a duty to protect our patients' privacy and confidentiality, so I can't disclose any further information other than they were admitted for non-COVID related matters earlier in the week.
Go ahead, Ian, with your follow-up.
Yeah, and I think this was covered before, but at what point, if you do find more cases, when could there be restrictions on visitors or other impacts on operations there?
So certainly the unit where we've identified those patients has been closed to admissions and visitors, except for extenuating circumstances for compassionate reasons for family members. So we do have those immediate containment measures in place, and as the situation continues to evolve and we gather more information, there could be further information with regards to restrictions, but right now it is just the unit that we've identified of concern.
Next, we'll go to Adrien Blanc, Radio Canada. Go ahead, Adrian.
Thank you. Dr. Strang, you mentioned it briefly, but about transmission in schools, why not say which group of students is impacted and say to the whole community, or how many cases there are precisely in the school? That's something that many parents request. Thank you.
I mean, that number changes on a daily basis, whether they're active cases or, new cases. So we continue to communicate when there's exposures in a school to staff and students. And then we're just, we're using our daily media releases to inform people about activities in schools as well.
Go ahead, Adrian, with your follow-up.
And I also wonder why some schools are so impacted and others are not. Taking the example of Marymount, for example, there were 10 exposures since September, the beginning of September, and other schools never have any exposure. Do you have any idea why?
It's related to the catchment area for the school, what the activity is in the surrounding community. A school like Marymount, because it's a French language school, has a much wider catchment area. So there's a number of factors and dynamics that go on that why 4 of our schools, 1% of them, have had enough activity that we've had to close, whereas the vast majority of schools have not had any major impacts from COVID COVID or any COVID at all. It's all related to what's going on in terms of the COVID activity in the surrounding community and the families in the community that access that school.
Next, we'll go to Chelsea Gould from the Truro News. Go ahead, Chelsea.
Hello, Dr. Strang. Since the proof of vaccination was implemented 2 weeks ago, have any businesses been reported or fined for not asking for proof as required?
My understanding from the enforcement team is that they continue to do their compliance with a focus on education, and then when we've had a very small number of businesses, the vast majority of them are very compliant, and when we've had some challenges initially through an education approach, everybody's come into compliance based on that.
Go ahead, Chelsea, with your follow-up.
Okay, and could you maybe describe the frequency of the compliance checks from the inspectors? Are they only checking spots that are reported?
No, we've had a comprehensive plan. So when this was brought in a week ago, our inspection staff made up of folks, our food safety inspectors, alcohol and gaming, and then we have occupational health and safety inspectors as well. They were doing a proactive reach out, and their initial focus has been on places where there's a high volume of people moving in and out. So restaurants, gyms, etc., have been a focus for their. As I said, they're taking an educative approach, making sure people are doing what's necessary, and the vast majority are. And the rest, when they're told what's required, have come into line. We also have a complaints-based driven process as well.
Next, we'll go to Pat Healy from the Laker. Go ahead, Pat.
Hi, this question for Premier Houston. What do you have to say to business owners that are learning they will now have to use their own technology to download the app for the QR code?
Hi, Pat, and thank you for the question. And I believe that there'll be, I don't expect much pushback on that. I mean, people are used to downloading apps and using it, and I think this will be pretty efficient for them. And overall, I haven't had, touch wood, I guess, but I haven't heard a lot of complaints from business owners. And as I've been out around, the system seems to be working pretty well. And Nova Scotians know that these steps are in place so that they can keep us safe, but that also so we can enjoy some of the freedoms that we're experiencing here. So what I would say to them is bear with us. We're getting through the pandemic, but we're trying to keep people safe, and we expect it'll work pretty smoothly.
Go ahead, Pat, with your follow-up.
For Dr. Strang, I know it's hard to look ahead even a month, but what do activities during the holidays, such as community parades and tree lightings, look like in Nova Scotia this holiday season?
So thanks for the question. I'm hopeful that by the time we get there, late November into December, that we'll have even, we'll be coming out of the fourth wave. But you have to remember, right now, we don't have any restrictions on types of gatherings other than the people participating have to have proof of vaccination. So people should be planning those pre-Christmas type of events on currently what's in place around the requirement for mandatory masking in indoor public places and proof of vaccination. And if we're able to move away from those at that time, well, that I would see that as a bonus. But I think the safest precaution would be to plan it like we're going to be like we are today, which, as the Premier has said, we have a lot of freedoms that we're able to have that many other provinces don't because of the hard work everybody's doing. But we got to stick with a couple of key safety measures that allow us to then have gatherings in all sorts of ways that bring people together.
We'll come back to the room for two more questions if you've got it.
Premier, I don't know if this is for you or for Dr. Strang, do either of you have an update on the progress of ensuring vaccination status from public sector workers and healthcare workers? Are you seeing an uptick there, or is it too soon to know?
Well, again, with the part of this is what we're seeing. There's still dry. We still have several hundred people a day that are coming looking to start their vaccine series, and certainly, unfortunately, some of them in an inappropriate way are telling us that they that the reason they're coming to get vaccinated is because of the proof of vaccination policy.
Ms. Lamb, do you have any concerns about that requirement affecting your staffing levels within Western Zone?
We are working certainly closely to validate our proof of vaccination of our employees, and currently are hopeful that we've had a significant positive uptake of vaccination rates, but time will tell once the policy comes into place.
Have you had any negative experiences with the requirement for visitors to be fully vaccinated? Is that going smoothly?
It's going relatively smoothly. We've had some instances that have required some de-escalation, but otherwise people, for the most part, are willing to provide the proof of vaccination so they can see their loved ones. And certainly we take any matters where there has been challenges or people aren't able on a one-on-one basis to ensure patients in our hospitals have support people that they need. But all in all, it's going well.
Has there been any violence?
Not to my knowledge.
Is it strange that visitors are required to be vaccinated well before the staff who are there every day have to be vaccinated?
I think it's certainly an opportunity, and our staff are aware that they are protected through vaccination, and we're working to have our staff protected, and visitors and support people, and certainly we have essential support people on a case-by-case basis that we look at if they are not vaccinated yet, so that our patients can have support people with them.
Thank you very much.
Thank you.
Thanks, everyone. We're doing well in this province. We really are, but we can't let our guard down. And certainly, when it's time to act, we will act. And I think that's what we're seeing with some of the school situations. That's certainly what we're seeing with Valley Regional. When it's time to act, we will act for sure. But good questions today. I appreciate that. We're getting closer to the end of the pandemic. We all hope, but with continued progress, we'll get there. There's a vaccine for children that's in the works, and hopefully will be available within the next couple months. We're rolling out booster shots for residents in long-term care and the immunocompromised in Nova Scotia. Our vaccine numbers are good, and they're still climbing. So these are all good things. Most people are following public health measures. I know we're all tired of the pandemic. That's for sure. But Nova Scotians are known for their resilience, for pushing forward in the face of adversity, and we're seeing a lot of that in this province right now, and I thank Nova Scotians for that. So thank you all.